So I think the first and obvious question for patients is, well, great. Does that mean that this is something that I can do now? That if I'm being told that I need, for example, chemotherapy and then surgery or chemoradiation for my muscle invasive bladder cancer, can't I now just go on to surveillance? And the first very important point is that this is by no means a standard of care. This has been a clinical trial, number one. And number two, these are interim results. And number three, there are at least two other trials trying very similar approaches, simply using slightly different gene panels and slightly different pathways that really need to be reported upon. And so this is not a standard of care. We always encourage patients to participate in clinical trials. And in fact, we have a second trial called RETAIN 2, which utilizes the same approach, but brings in immunotherapy as well. So patients are treated with chemotherapy plus immunotherapy first, and then a decision is made about going to active surveillance. But I think what it tells us is that there is a possibility, there is an opening there that we need to fine tune and we need to keep working towards, that would potentially allow patients to be spared surgery and really improve their quality of life. Because that's, again, the bottom line, not to impair any oncologic outcomes, not to decrease any oncologic sort of endpoints like metastasis-free survival or overall survival, but yet at the same time allow people to keep their bladder. And that's what we're working towards, that's what other groups are working towards. And I think really as a community for patients, this means that this may be an option in the future. It is not ready for prime time right now.